Hi, I'm Dr. Nicholas Cohen, and I'm here to share with you a top 10 list of tips for acute sinusitis. Tip number 1 is how to identify acute sinusitis, and these tips are for adults. So, your sinuses are hollow spaces in the bones of your face, located here and here, and they connect to your nose. If you have acute sinusitis, acute means that it's been going on for 4 weeks or less. And sinusitis is basically swelling and inflammation of the hollow areas in your facial bones. Usually happens after you have a cold. And you'll have pain in your face, sometimes in your teeth up here, sometimes over here. And the pain is usually worse if you're bending forward. Tip number 2, when to see a doctor. So sinusitis, acute sinusitis, is most of the time, about 98% of the time, caused by viruses. And usually your pain will go away in 10 days. It will go away on its own and you won't need to even go in to see a doctor. If, however, you are infected with bacteria, it's more likely that the infection will not go away on its own and you'll need antibiotics, so you'll need to see a doctor. If your symptoms, if your pain has been going on for more than 10 days, you should see a doctor. A lot of times doctors will treat with antibiotics, typically amoxicillin 500 milligrams 3 times a day for 14 days, if you've had symptoms for more than 10 days. Alternatively, some doctors will choose to wait an extra week to see if the symptoms go away on their own. But you should see a doctor if your pain and congestion have been going on for 10 days or more. Other reasons to see a doctor and for possible antibiotic treatment are if you have a high temperature, like 102.5, or if you have severe pain, or if you have vision changes. Any symptoms that interfere with your life significantly or cause severe pain or high temperature should be evaluated by a doctor. So tip number 1 was how to identify acute sinusitis. Tip number 2 is when to see a doctor. Tip number 3, to prevent acute sinusitis, which usually comes after a cold, you should not smoke. Smoking increases your risks of having colds and then developing sinusitis. The time it will take you to get rid of the cold, because your immune system is impaired, is also longer when you smoke. Tip number 4, another way to prevent acute sinusitis is frequent hand washing. If you are acute sinusitis, which starts as a cold, begins most commonly with someone who's sick touching their nose with their hand, either shaking your hand and then you touching your nose with your hand, or someone who's sick touching their nose and then touching something like a doorknob or a keyboard, which viruses can stay on alive for several hours, and then you touching the doorknob or the keyboard and then touching your nose. So it's important to frequently wash your hands to prevent the spread of the infection. Tip number 5, another important way to prevent colds and worsening symptoms is the influenza and pneumococcal vaccine. The influenza vaccine is recommended in everybody starting at age 6 months and should be repeated yearly. You can get the nasal spray influenza vaccine if you're a healthy adult younger than age 50. And furthermore, the pneumococcal vaccine also can prevent complications from the cold or sinusitis. It's recommended in all adults age 65 or older. It's a one-time vaccine. Or if you're younger than 65 and have a health problem such as asthma, diabetes, or if you smoke, it's recommended that you get the pneumococcal vaccine once before age 65 and then again at age 65. This will prevent complications from the cold or sinusitis. Tip number 6 is mild analgesics. Analgesics or pain relievers can be helpful for the pain that's associated with sinusitis. You can take acetaminophen or the brand name Tylenol. It comes in 325 milligram tablets. You can take 2 tablets every 4 hours. That's the maximum you should be taking. Another analgesic, which is a little more powerful, is ibuprofen, or otherwise called Motrin. It comes in many size tablets, but you can take up to 400 milligrams every 4 hours. Tip number 7, topical decongestants. Topical decongestants can help clear mucus and nasal congestion. The most effective brand, or the most effective one, is oxymetazoline, which is also, the brand name is Afrin. It's a nasal spray. You can spray 2 to 3 sprays in each nostril twice a day, but don't use this for more than 3 days, as you can have what's called rebound swelling if you stop using it. So only use it for 3 days to not have that complication. Tip number 8, intranasal steroids. So mometasone 200 milligram spray in each nostril twice daily can help reduce inflammation and swelling. This, though, it has to be prescribed by a doctor. Tip number 9 is nasal irrigation with saline. This is, the brand name you can get in the store is Neti-Pot. This will help clear out mucus and your nasal passages and is effective in symptom relief when you have acute sinusitis. And tip number 10 is to believe in yourself. Sinusitis is a very common complication after you have a cold. These tips that I've given you, I hope, will help you decide when you need to see a doctor, help you use ways to prevent getting sinusitis, and will help you treat sinusitis if in fact it develops. I hope these tips have been helpful. Thank you very much for listening, and have a great day.